Senate Chair of the Health and Human Services Committee, David Hann, joins me now to talk about the Supreme Court ruling on what has been termed Obamacare. Senator Hann, thanks for joining us.
Nice to be here.
Senator, you've been a vocal opposition, very vocal opposition, leading really the effort statewide to oppose this federal Affordable Health Care Act. First of all, were you surprised by the Supreme Court's decision?
Well, in part, I was surprised by the fact that they discovered this to be a tax when the statute doesn't mention it as a tax. And in fact, the president and all the proponents were at great pains to say it wasn't a tax. And in fact, in the course of passing the bill, they made clear it wasn't a tax. I think it would have not passed, frankly, had they described it as a tax in the statute and in the course of passing it. So that was a surprise to me. But I think ultimately, those of us who oppose this law always believed that no matter what the court did, that there would be a need to have the political process weigh in. The public has to decide what kind of tax or what kind of healthcare policy we want to have, and whether we want the federal government to impose their excessive intrusiveness into personal decisions about healthcare, or whether we want those to be made by individuals, doctors, and the policy made at the state level. So I think from that perspective, this hasn't changed at all the requirement that this be ultimately decided by the people at the election booth.
There are so many facets to the Affordable Health Care Act. You know, we have the children who can be covered under their parents until they're age 26, et cetera. Are there any elements that stand out that you support? Well,
I think it's hard to agree with the things that it's hard for me to say I can support it, because I think the premise of the bill is so wrong, so wrong-headed. The idea that by federal action that we can go in and do these things is really antithetical to not only the tradition we've had in this country, but as a practical matter, a way of doing it. We have always found in other areas, education, you name it, there's always been this tension and, in fact, problems with having the federal government come in and say, here's how you must do whatever it is that they're asking us to do. And when you're talking about health care, which is very personal, and to have this federal regimen dictate to us is hugely problematic. So it's hard for me to say, well, are there aspects of that you like? And I don't think so. I think the premise is so fatally flawed that it's hard to say that there's anything that I would like. Now, there are things about the current state of our healthcare system that do need reform. I agree that that is true, that we all can agree to that. But the remedy has to be something that is enacted locally, and I would argue has an emphasis on trying to make sure that we have a strong marketplace for consumers and individual families.
How do you think this Affordable Health Care Act will impact Minnesota?
Well, I think a lot of that depends on what the election does and whether or not the people ratify this through their votes at the polls, or whether or not they reject it, depending on who we elect in the fall. But if we elect the same folks, if we keep things as they are, I think the first question will be, what is the implication of these federal laws on things like the exchange, on things like health insurance? Is it going to be possible for people to retain health savings accounts? Is it going to be possible for people to continue to make their own choices with respect to health care or not? I think there's a lot of questions about this law that are not well understood, and because they haven't been yet implemented. But if this law stands and there's not an effort to repeal it in the Congress, then I think those questions will have to be addressed.
As chair of the Health and Human Services Committee, you, as I said earlier, you've been opposed to this act, but you've been very vocal in your opposition to a health care exchange. In the capacity you're in now, will you support it, or will you work to try to craft one that's positive for Minnesota?
Well, the first thing I would want to do is get the governor to talk about what it is that he's doing. He's got a group of people that he's paying millions of dollars of taxpayer money to act as a governing body for an exchange, but he has refused very directly to respond to any questions about what they're doing, what kind of policy he wants, what is he putting in place. He's
questions from you?
Questions from our committee, questions in our committee to his representatives, Commissioner Rothman and others have been very, very clear about not responding to those kinds of questions. And so nobody knows. And I think that would be the first thing, is to find out what is the governor trying to accomplish. I don't think that we can do anything to enact an exchange without the help of the legislature, without something positively done by the legislature. And I think that before we do that, we want to know what the governor has been up to. And I think we need to look at what are the requirements under the federal law and whether or not it makes any sense to have a Minnesota version, or if in fact there really is no difference between what we can do as a state and what the federal law requires.
And again, as chair of this committee, how do you see your role, assuming you're in this position again next session, when it comes to beginning to implement and roll out other facets of the Health Care Act?
Well, I'm going to be continually looking for ways to preserve the independence of the state of Minnesota in their ability, and I believe it's a constitutional requirement that we retain our independence as a state. We are not an administrative unit of the federal government, and I think it's very important that we do everything we can to make sure that laws that affect the people of this state are written by people that are elected to govern this state. And I think that's going to be something we'll all have to work at.
Senator, my last question for you is, Minnesotans obviously are going to be asking a lot of questions about what this means to them. What do you think this means to them?
Well, I think it confronts the public with a very fundamental choice. What kind of government do they want to have? Do you want to have a government that is going to assume very broad, very expansive, very intrusive powers into very personal parts of our lives and turn over massive amounts of regulation and taxing authority? Or do we want to restore the idea that individuals, families have the ability to govern their lives? That to me is the ultimate question. I think that the public needs to ask themselves that when they go to the polls in the fall and ask, are we electing people who are going to respect that, or are we electing people who are looking for further expansion of federal power?
Thank you for joining us today. We
Thanks,
appreciate your time.